Hi, hello everyone. Yeah, I'm back again. Thank you so much for joining again. So today we want to be talking about I want to talk about miscarriage. A lot of persons have been experiencing this miscarriage, and they can a lot of newly married couples have been experiencing this miscarriage, but they are unable to, they don't know who to tell, or who to actually ask about it. And miscarriage, you might not know how a lot of persons have been experiencing issues on this miscarriage, and it's not something that is easy like that. It's something that is not that very much easy. Miscarriage is something that um, I have to actually look it into. So, what is miscarriage itself? Miscarriage itself is the spontaneous loss of a woman pregnancy before the 20th week. That is, it can be emotionally painful and it can be physically derailing. So I said, talking about stages of pregnancy, I said the first stage is first, that is week 1 to week 12. That is, the person has even gone to second stage of pregnancy already and has lost the baby. So that is what is called miscarriage. A lot of layman call it abortion. Abortion actually has its own different terms itself, and the meaning of abortion. Abortion is when a baby is being lost after 24 weeks of pregnancy. That is when someone can say to have abortion. So there are two different things, and it means two different things. So abortion means a lot of another thing entirely. Why miscarriage also means something different entirely. So it's two different thing, and it's two different ways. So miscarriage is something that comes spontaneously. Why you can decide to go and abort a baby. You understand? That is what that abortion comes to. You can actually decide to get rid of a baby, maybe because the baby is having abnormal deformity or abnormal malformation of the baby. So you can actually decide to actually have an abortion. You know, in some country legalize having abortion, while some other country do not legalize it. So it's a decision you can actually make and you can actually take. So today, like I said to the topic, I said I want we'll be looking at causes of abortion and how we can prevent abortion. I said something is spontaneous, that is without being planning it. It's something that is unplanned. It's something that you don't think of that will just come. It's an expulsion of a fetus that has been growing in the womb. Something that comes forcefully. Something that comes and in some countries, in some developed country, someone that has abortion of 20 weeks, like 20 weeks, let's say 20 weeks, now there is a way they can still at least manage if the baby can still have an abortion, which is not too good for us to actually talk about this, so we can know how and what to prevent miscarriage. Yes, thank you to everyone that subscribed to this channel. That's been great joining on this. You love everything that will be coming on this channel. I would, put in my best to make sure that you would learn a lot. Your children will understand, and even you can leave this to children, your friends, newly married, and all. So, first thing is that when the first cause of that miscarriage is ignorance. Ignorance is a disease. I know you know that. So when couples first got married and they are ignorant of what can happen, like they are ignorant that something can cause something. If you're ignorant that something can lead to abortion, you won't actually you might not actually do it. Let me say, if you know that something will lead to something, you will not do it. Something you will lead to something you don't want is ignorance. And a lot of married couples, a lot of married couples is experiencing this. Let me first clear this. If you have a constant message, surely you message every 24 days, you are seeing your ovulation, and it's a constant thing. So, sorry. So it's so normal that immediately you are married and there is intercourse, and you miss your period for more than 8 days, then you now see the period. Definitely something has happened. Conception might have happened and you have miscarried it. Because some persons will say, I noticed that my body, I'm not body, I'm feeling this, I'm feeling. But when the person check, the person sees that it is negative, it's not positive. So definitely something might have happened to that fetus while it's growing or while it's being nurtured. Let me explain fertilization. What fertilization is again? So fertilization is when the sperm meets the oocyte, then they fertilize to form a fetus, a growing fetus. It starts like this. They begin to divide, multiply, division, multiplication, division, multiplication. Then it begins to grow. That is where fertilization begins. So the that's fertilized ovum that is being implanted. Like I said, it will implant into the womb, into the uterus. The uterus is like a loamy ground that you plant your stuff into. So now, if I'm using maize, for example, you get like 2 or 3 maize. You want to plant maize or corn. So you tilling the ground and putting it inside. That same process is how the fertilized ovum will find its way underneath the uterus. Will find a way to embed under, like let's say this is the uterus is a pouch, like something like this. So let's say this is part of the uterus. So the fertilized ovum will find its way into, let's say it's going to find its way into this, under this lining, under this first lining. So it's going to find its way under it. So this, I'm explaining this to explain to help us see a glimpse of what can, some things that can cause miscarriage. So when this thing is implanting itself, so let's use that maize as an example. So when the maize is implanting itself now, and you didn't till the floor very well, you just like take a little bit of the soil, then you just put the, or you just pour the maize or the corn on the floor. So when it starts coming up, you see that there's no stamina. The roots is unable to hold some staminas down there because it's not implanted deep down in the soil. So therefore the maize will be destroyed. It can't even grow to get stamina, talking less of bringing out fruits. So just simple as this, if anything is preventing the fertilized ovum to get implanted well into the uterus, definitely there will be miscarriage. It can't stay long. That is why some people will get pregnant. They'll be pregnant for 2 months, 3 months, the fourth month, and yet it still come down. So that is something that's happening to the implantation. Maybe it is not well implanted or some other things. So that is the number one thing. So we'll be explaining and I'll be discussing what can can cause miscarriage. Number one thing that can cause miscarriage, like I said, is ignorance. Ignorance that you might be infected. The number one leading thing that gets infected, the number one thing that might, one of those things, I'm not going to mention that in order of priority, but I'm going to mention them as they come. You understand? I'm going to just be mentioning it as it's been coming. So number one thing is miscarriage. Miscarriage. Sorry. The number one thing is infection. So when there's an infection, either the female or the male, for example, the same way, the same routes the sperm is passing through, that same way is where the semen, where that has sperm in it, is going to pass through. So now when there are some infections around that area, definitely those the semen and the sperm will also be infected. I hope you agree with me. For example, the pipe you are using to get water is dirty. It harbors a lot of infections. Then you still use that same pipe to get drinking water into your drinking jar. Automatically you are infected. It's just as simple as that. So infection is something that affects a lot of couples. And a lady also can have maybe infection, urinary tract infection, malaria, typhoid. All this can stop pregnancy from, all this can stop the egg from implanting well, or stop pregnancy from maturing to term. Yeah. So the first thing is, you need any married couples or getting to get married, like few weeks, couple of weeks to your wedding ceremony. I beseech you to treat infection, any kind of infection, urinary tract infection, the chest infection, abdominal infection, any tract infection, treating malaria, treating typhoid, and making sure that you are just pure. I don't want to use sterile because sterile means something else medically. So you need to be clean. When you tell some couples to treat infection, they be like, I'm not humanizing. Oh, I'm not seeing another guy. Oh, I've not had sex for this. Oh, I don't have sex, even I'm a virgin. Treating infection doesn't mean that maybe you are humanizing or you are having different sexual partners. Let me use this example. When you deworm, do you actually eat worm? Like when you ask someone that you need to deworm, do you actually eat worm? You don't. But you contact, or you get, there are worm infestation from what you are eating, maybe from the meat you are eating that is not well cooked, or you ate out or something. That is where the maybe the parasite of the worm gets into your stomach, and you begin to incubate worm. And all you need to do is you need to deworm to get yourself back. So it's just as simple as that. It's not until you think you need to or maybe you are humanizing, or you are this or you are that, before you can actually treat infection. So infection is something that you should take as priority. You should treat as time. You should treat with time. I'm sorry, I'm trying to adjust my camera. Yeah. So you should try to get ready to treat infection like couple of weeks to your wedding ceremony. So getting yourself prepared for baby, especially when you're getting, even if you're not getting yourself prepared for baby immediately after your wedding, it's so essential that affected in any way. So I think, and I hope you get that. So number one thing, like I said, is infection. Number one thing, ignorance. Number two, infection. Number three, stress. A lot of persons just think this thing is just a joking matter. Like you don't compare yourself as a lady to someone else. Like you, when I'm telling someone, I'm actually educating someone about stress. The person is like, I'm not doing much. This is what I've been doing since this and that and that. Pregnancy is a stage entirely. It's something that you can't predict what will happen. It's something that you can't actually have it or preconceive in your heart that during my pregnancy I will not see it. Like it's something you can know. It's not something you don't even, you won't even if you are carrying, like if you have five children, the way that you feel the first pregnancy will be different from the way you feel the second, the third, and the fourth and the fifth. Different ways, you know. One might be a little bit more cool for you, while the other might be something you did not bargain for. So pregnancy comes with its own uniqueness. Pregnancy comes with its own issues. Pregnancy comes with its own beauty. So during pregnancy, you need to understand that your system might not be yours. Let's say, because some women say, I'm not feeling myself. Your system, especially that first trimester, you might not feel yourself. Like your system might not be yours that particular time. So you need to understand that your system might not be yours that particular time. So you need to actually cut down stress. 11 days, 8 days, they've seen their period again. They ask what is happening. You tell them it's stress. No one wants to leave their job. No one is telling anyone to leave their job. You do workout. I've seen newly married couples. You start doing workout. Maybe the workout you have not really been doing before you got married. Just because you got married, your husband does that. So you start working out and you want to achieve pregnancy. Start working out. All these are things you need to consider when trying to nurture a fetus. If your system will actually allow you to do all this strenuous exercise. So I said stress. So I'm still talking about stress. Strenuous exercise is a form of stressor to your system. The kind of work you do, if you cook in a kitchen that is full of too much normal system. Normally, if you are staying in a way that the heat is too much, you with staying in a place that the heat is extraordinary, you might feel a little bit. There might be a little bit discomfort. Another thing is a country that is biting to and on marriage, you check and be sure that you're actually taking the right measures to achieve pregnancy. So, so the next point I'll be talking about is hormonal issues. Those that have PCOS, that is polycystic ovarian cyst. So those ones, those people, they have issues also. They can have issues also with miscarriages. So you can also work with this. Your gynecologist can help you work through this, and you can help you to achieve pregnancy. Another thing is, like I said, that one is hormonal irregularities. That hormonal irregularities can also deal with maybe you not having regular menses, hence getting to regular ovulation, or you are menstruating, you are not ovulating, or you are your hormones. You know, this ovulating, not menstruating is deals with hormone, estrogen, progesterone, and if this hormone, if there are abnormality, or let me say irregularities with this hormone, when there is too much of something, where something maybe when there is too much of this, when this should be, and this actually can lead to what is it called? What is it called? Miscarriage. Another thing is maternal age. When somebody is elderly person, but I've at the long run I've been working, age does not matter during pregnancy, but as research have known that when you grow like from 35, 45 upwards, there is an high risk of miscarriage, and somebody can have more often miscarriages. The next thing is uterine abnormalities. When there are abnormalities in the uterus, maybe there's growth of growth of the uterine tissues into somewhere else, or maybe there is anything, any kind of thing can cause anytime any kind of abnormalities in the uterus can cause miscarriage. There's also what we're known as genetic genetic issues. That is maybe sex of the baby, chromosomal issues. All this can lead to miscarriage. Also, exposure to environmental and workplace hazard. I talked about environmental hazard, which is cooking in a kitchen um that is too hot, and radiation of toxic agents. If you are working in a chemical complaint, this can lead to an issue. Another vital thing is incompetent cervix. Yes, I really need to discuss this. Incompetent cervix can and mostly leads to miscarriages or abortion when the cervix can hold the uterus, can't hold the content of the uterus. Let me explain where the cervix is and how it can actually affect what we're talking about. Like I said the womb is a pouch like. Let's say this is the womb. So the mouth of the womb, which is this place, is the cervix. While this long one is the, what is it called? Let's use this as a vagina. So this is the vagina, this is the cervix, and this place is the womb. So when the service is too fragile that can't hold or accommodate or can take hold what is in the uterus. This can lead to miscarriages. This can lead to miscarriage or abortion. Then another thing is lifestyle, the person's lifestyle. When you are pregnant, it is said that you should stop smoking, stop drinking, stop alcohol, illegal drugs, and all that. When one continues to do this can lead to miscarriage. Then the next point is severe kidney disease. When one has a kidney disease, any kind of disease itself, when you have asthma, kidney disease, congenital heart disease, or diabetes, thyroid diseases, and anything like any disease can actually affect the pregnancy and can affect the success of pregnancy. So now I think there are lots more of things that can lead to miscarriage. But those are the points I can actually lay my finger on now. So I'll be talking about symptoms of miscarriage, and then I'm going to round it up by preventions. I've talked about some prevention earlier, so we can make this video short, not too long. So I can talk about something else. So signs and symptoms, or let me say symptoms of miscarriage. The first thing, you might be feeling menstrual like pain at your lower abdomen. You'll be feeling as if you want to see your menses. Those kind of pain you feel when you want to see your menses. Menstrual like pain. Yeah. Then you begin to feel like that cramping. When you begin to feel, you have like abdominal pain. From there, you start having abdominal pain. Some persons have headache, severe headache, that the head will be pounding like you don't really know how you can describe it. Then another thing is severe back pain. You started feeling back pain that you can't explain, unexplained back pain. Then, and the last thing is when you are seeing bleeding that comes from light to heavy. If the bleeding might first come like a spotting. When it spottings, then it start coming like a message. From there, those are the symptoms of miscarriage, and that is the baby has been miscarried already. So diagnosis, I don't really think diagnosis is you go to the hospital, they check through ultrasound, and to confirm that you've actually miscarried the baby. Now, this what are you going to do after a baby has been miscarried? I know it's so painful and it's so disheartened for you to have been planning to want to see your precious little being there, and unfortunately you've miscarried the baby. You have to be strong for yourself and take heart. So you need to go for to the hospital for something we call MVA. It is called manual vacuum aspiration, depending on the age of the pregnancy actually. When it gets more older, they do D and C, which is known as dilatation and what's curettage. So any of these two is what they were going to do. And why are they doing it is that they need to actually evacuate every product of conception. When you lose some amounts of blood, there are some products that are still there, maybe the placenta or the tissue. If it is not being getting rid of, you can might lead to severe bleeding and might put your life at risk. So whenever you see this, after being confirmed that you've lost a baby, you need to go to the hospital for them to do total removal of any conception, product of conception. But when you go to the hospital for checkup, like I said, for confirmation, that sometimes that when they do this scan, they detect that every product of conception is out totally. So then, if it is out totally, your gynecologist or your doctor or your midwife is gonna just give you some antibiotics and some analgesia for you to be calm, to calm your nerves, and for you to wash out any kind of infection that might lead to. So the D&C, or the manual vacuum aspiration, is just a minor procedure to get out any remnants of product of conception in the uterus, and this will help you. So after this, you really need to do blood test, genotype test, and other medical necessary tests to prevent it from happening again. it is very even get to go to the hospital because they just see it as normal thing, and this will keep repeating itself, which is not too good. Which is not too good. Like I said, it's very bad. So you really need to know the causes of that miscarriage. This will help you to take further steps to make sure that it doesn't repeat itself again. I hope you get that. So this is very important. So it won't repeat itself again. So from what I've explained, I said um prevention of miscarriage now. How do you prevent miscarriage? Make sure you are okay. I don't want to use sterile. Make sure that you are free from all kind of infections. That is number one. Number two, make sure you are not ignorant of what miscarriage is and what the causes of miscarriages. Number three, make sure that you take care of yourself when you are trying to conceive. And what are the prenatal things you need to do? By taking your folic acid, 400 microgram of folic acid you should be taking daily, just a tablet daily. This will help to prevent miscarriages, neural tube defects, and some other things. And this will help you to achieve healthy pregnancy as a mother. So this is like a prenatal care for you and for your baby to achieve healthy pregnancy. That is the third one. The fourth one is you need to see your gynecologist to be sure your hormones are in right numbers, in right standing, and your body is um ripe, ready to nurture a baby. Another thing is after miscarriages, like I said, you need to go for some medical checkup. So you going for medical checkup, you should know your husband's genotype, resource factor, and all that, so you would know what can actually lead to that kind of to actually prevent further miscarriages. So and to further prevent it. So and another thing is you reduce the kind of exercise. If you start engaging in exercise, you reduce your exercise, the way you work out, you reduce the way you stress yourself during work, you reduce traveling during this period. Is very, very, very essential. That when you are trying to achieve pregnancy, or when you are at the early stage of pregnancy, you reduce traveling either by air or by road. Then you reduce eating of spicy food or having any emotional or stressor. All this which will lead to miscarriage. And don't forget that immediately you decide that you are pregnant, you need to go for medical checkup and to start antenatal ASAP, that is as soon as possible. I hope you have learned one or two things from this video. If you like it and you love this video, please don't forget to give it a thumbs up. Kindly share with everyone that will be needing to see this video. And don't forget to subscribe to this channel if you are yet to subscribe to this channel. Yeah, I've just given this little out of a lot. So if you have any question that is bothering your mind or you want me to talk about for clarification purpose, you can drop that at the comment section and I'll gladly attend to it. Thank you for coming and thank you for watching. Bye.